my name is Christy Andrade. This is my physical assessment final video. Hi Morgan, my name is Christy Andrade. I'm going to be your nurse practitioner. Do you mind if I videotape you for the purpose of my class and share the video with my teacher?
Yeah, that's okay.
Excellent. This is Morgan. Her chief complaint for coming in today was a sore toe. So her HPI is she has a toe that has been hurting for 2 days. She came in today because the pain on a scale of 0 to 10 was a 5 while walking and a 1 while just sitting down. I asked her how the quality of her pain is. She said it's just throbbing. She also says that with rest and elevation that relieves the pain, but with wearing shoes and walking that hurts the pain and it makes it worse. So since then, I have actually taken the ingrown toenail off her toe, and so we have a plan of sitz baths to make it feel better. Currently, Morgan has no allergies. Her past medical history is she had childhood asthma. Her last flare-up was at the age of 16. Since then, she's had no problems with asthma and doesn't even have any albuterol inhalers. She has no surgical history, and she goes to her gynecologist every 3 years, and she's never had an abnormal pap smear. She also has no psychiatric history. Medication-wise, she is on the NuvaRing for birth control, and she has no allergies. For family history, her sister had papillary carcinoma of the thyroid, and that was extracted June of 2015, and she is now cancer-free. Her mother has migraines, and her father has hypertension. Her maternal grandmother also has migraines, and her maternal grandfather has hypertension and diabetes. Her paternal grandmother has no significant problems. She is very healthy. She did have migraines as a child, but outgrew them. And her paternal grandfather has hypertension, diabetes, and high cholesterol. Social history-wise, Morgan lives in Tempe, Arizona, and lives by herself with her dog. She currently is a nurse at Phoenix Children's Hospital and works at the CVICU. She loves her job, even though it's stressed, she has job satisfaction. She denies any tobacco use and illicit drug use. She does enjoy the alcoholic beverage on occasion, where she drinks about 3 glasses of wine a sitting, and this is socially with her friends. So, Morgan, right now, just want to look at you visually. She is well dressed. She has her hair done. She doesn't smell. You can tell that she's showered. She's sitting up straight. She has a smile, and she has great orientation to person, place, and time. So, all right, Morgan. I'm just going to do a little bit of hand hygiene. And during this exam, please let me know if you have any pain, okay?
Okay.
If you have any pain or anything, and I'm also going to be looking for any kind of distress. So what I'm going to do is I'm just going to do a head-to-toe full-on physical examination. So first I'm just going to look at you. You have gray skin color based on your ethnicity. You can tell that she does have a henna tattoo on her right forearm. Besides that, she has no rashes, no other problems. So what I'm going to do is I'm just going to do a scalp and hair. You can tell that you have great hair distribution. I'm going to go from behind you. I'm just going to palpate your scalp and feel for any lumps and bumps or any super lice, which I hear there's an outbreak.
Oh, wow.
Yes, and I don't see any, which is great. Okay, and so next I'm just going to look again at your face for symmetry. Good symmetry. So what I'm going to do is I'm just going to check to see if you have any problems with your sinuses. Let me know if you have any pain, okay? I'm just going to put some pressure. Any pain on your sinuses? And since we're damping, can I have you open and close your mouth? Excellent. Just checking for that. For any TMJ or anything? No? Okay, so what I'm going to do now is the easiest way to continue with this examination by doing a head exam is to do cranial nerves. So the first cranial nerve I want to do is going to focus on your nose. So I'm just going to look at the inside of your nose. Have you ever had any problems breathing? Excellent. No deviated septum. I don't see any polyps in there. So what I'm going to do is I'm going to test your sense of smell, okay? So what I'm going to do is I'm going to have you close one of your nostrils. When you're ready, I'm going to tell you to smell. So close your eyes, close the nostril, and let me know what that is.
Cinnamon.
Excellent. Now you're going to do it to the other side. You're going to close your nostril. Let me know what that smells like.
Pepper.
Excellent. Great job. So cranial 2, 3, 4, and 6 all have to do with your eyes. So what I'm going to do next is I'm just going to look at your eyes You have good eyebrow distribution and eyelash distribution. You have white sclera. Conjunctiva. Pink conjunctiva. Do you have any eye swelling or eye pain or irritation?
No.
Excellent. Yes, I don't see any styes or anything. So what I'm going to do is I'm just going to, before I go check cranial nerve 2, I'm just going to do 3, 4, and 6 just because it's less invasive. So I'm going to have you with your head non-motile. I'm going to have you just with your eyes. Follow my pen light. Excellent. I'm going to tap all the way in for accommodation. Perfect. And now we're just going to check peripheral vision, okay?
Okay.
So you're just going to go and still straight ahead. Let me know when you can't see my fingers.
Okay.
Excellent. And on this side.
Okay.
Excellent. So now I'm just going to look and check your pupils, okay? So again, you're going to still straight ahead. Excellent. Good. Consensual and direct and positive perla. So what I'm going to do next is I'm going to look into your eye. For the purpose of this exam, I'm only going to look in one eye, just for time purposes. Alright. It might be a little bright, so again, you're just going to look right past my ear. Okay. Go on it. Excellent. I'm looking to see if there's any hemorrhages, if there's any lumps and bumps in there, and everything looks really good. Okay. So that was cranial nerve 2, 3, 4, and 6. Cranial nerve 5 is sensation and it's a little bit of motor. So I'm just going to feel again. Let me know. Can you feel?
Mhm.
Because it's a trigeminal. Feel that? Can you feel that?
Mhm.
And 7 is more motor. So can I have you winkle your forehead? Can I have you smile? Can I have you blow a bubble? And can I have you spit your tongue out for a second? Excellent. Okay. So next is going to be cranial nerve number 8, which involves hearing. So first thing I'm going to do is I'm just going to inspect your ears.
Okay.
Your ears pierced. No redness, no irritation. Do you have any history of ear infections?
Mm-mm.
Excellent. So what I'm going to do is I'm going to do a whisper test. So I want to be able to see if you can hear. So can I have you cover that ear? And I'm going to whisper something. Let me know what I say.
Orange.
Excellent. Can I have you do the other ear as well?
Mhm.
And tell me what I'm saying.
Apple.
Excellent. So now we're going to do the Weber test. Let me see where my equipment is. Oh, so here. Okay, so the Weber test, I'm going to hit the vibrating fork. I'm going to place it on your forehead. Let me know if you can hear and feel the vibrations. Both sides the same, or if you have one ear that dominates over the other, okay?
Okay.
And what did you, the same?
Mhm.
Or, excellent. So again, I'm going to do this. I'm going to push this on your mastoid bone. Let me know when you can't hear it. Then I'm going to put it right in front of your ear. And let me know when you can't hear that. The air should be louder than the bone conduction.
Okay. Mhm.
Excellent. Thank you so much. Okay, so now I'm just going to look in your ear. Again, for the purpose of this, I'm just going to look inside one of your ears. Let me know if you have any pain or discomfort. You really shouldn't. Okay, I'm just going to see if you have any kind of ear infection, redness, swelling, if you have any perforations of the eardrum, or if everything looks good. No wax. Everything looks good. She has a nice pearly white little membrane, and you can see the little malleus. Excellent. Okay, so that was cranial nerve number 8. 9 and 10 has to do with the inside of your mouth. So first, I'm just going to look at your lips. Can I have you open your mouth? She has good pink, good mucus. Do you have any problems with dryness or anything? How about problems with eating or swallowing?
No.
Okay. So what I'm going to do now is I'm just going to say ah. I'm just going to put this on your tongue and look at your throat. Excellent. For the purpose of this video, I would, if I was testing this in the clinic, I would gag her with this just to make sure everything was intact. But for the purpose of the video, I'm not. I would say her cranial nerves 9 and 10 are fully intact. Cranial nerve 11 is a spinal accessory nerve, so that is going to adjust your shoulders. So can I have you shrug your shoulders up and down? And then can I have you put your hands out? Just adjusting her for ring scapula. Everything looks good. And lastly, cranial 12, which would be her hypoglossal. Can I have you stick out your tongue and move them back and forth? Excellent. No tongue deviation. Okay, since we've done the full head examination, I'm going to do your neck. Okay, so first I'm just going to look at your neck. I don't see any big lumps or bumps itself in appearance, so I'm going to palpate your nose, okay? Excellent. Maybe turn and look this way.
Mm-hmm.
And turn and look the other way. Excellent. I don't feel any notes. So what I'm going to do next is I'm going to palpate your thyroid. So I'm just going to go behind you. I'm going to reach around in the front, okay?
Okay.
Thank you. Okay. Cricoid cartilage. Can I have you swallow? Excellent. I don't feel any notes. Oh, excuse me. Are there any problems with that? Alright, since we're already doing your head and your neck, we're just going to do your cardiac examination now. So the first thing I'm going to do is just listen to your carotid for any carotid voids, okay?
Okay.
Excellent. I don't hear any. For the purpose of this examination, we are just going to leave her top on for modesty purpose and for video purposes. Okay, so what I'm going to do is I would be looking at your chest. I'd be looking for shape, symmetry, any scars, any malformation, or any rashes or bumps or anything else that I would want to be noted of. And I don't see any. And before I do the physical, I'm just going to check to see if you have pulses. Excellent, your pulses are good. The radial, 2 plus pulses, and they are even. Great rhythm. Let me check your Drusella's pubis. Again, 2 plus and regular. Okay, and let's just check your fingernails. No splinter hemorrhages. I don't see any clubbing. I don't see any spooning. Well, that's about a 2 plus cat refill. Look at your toes. Toenails are painted. Let me just check the cat refill on the bottom. It's about 2 plus as well. Excellent. And you are warm, dry for skin wise, which is what we want to see. Okay, so what I'm going to do is I am going to auscultate. I'm just going to put it on just for a moment. For the purpose of this exam, I'm just going to use the diaphragm. If I was doing this in a clinic, I would rotate from diaphragm to the bell. Listen to aortic, pulmonic, herbs, tricuspid, and mitral. Excellent. I do not hear any murmurs, and I do hear S1 and S2. And then I'm going to listen for the PMI, or feel for the PMI, which is going to go. I'm going to touch you right under your breast, and can I have you move forward for me, please?
Mm-hmm.
Excellent. Thank you very much. If I was doing another full exam, I would have her lie on the bed at about a 45 to 60 degree angle, and I would look for her JVP. For her JVP, I would look for a carotid pulsation. If I saw a carotid pulsation, I would do her sternal angle up to the carotid pulsation, and I would measure that. That should be about 4 to 5, should be normal for her. Excellent. So now, since we're already here, I'm going to do respiratory. Again, we've already looked. I'm just going to listen externally, and then I'm going to check it back in just a moment. You can take a deep breath in and out when I place my stethoscope in locations. Excellent. So now I'm going to go behind you, okay?
Mm-hmm.
Actually, I'm going to have you turn to the side. Can I have you put your feet right there? Excellent. So now I'm going to do the back of it. The first thing I would do, again, if she didn't have a shirt on, I would just look for her AP diameter, which looks great. Good for her. And now I'm just going to look at her breathing pattern, see how everything looks. I would look for any rashes, any moles since I'm looking at her back, or anything else. So what I'm going to do is I'm going to do excursion. So first respiratory excursion with my hand. And can I just have you take a deep breath in and out? And now I'm going to do lower back. Deep breath in and out. Excellent. So we're going to do tactile firmitus. So what I'm going to do is I'm going to have you say 99.
99. 99. 99. 99.
Excellent. Everything sounded felt equal in vibration. There's no problems. And next what I'm going to do, since we're already back here, I know this would be more in the GI portion, I'm going to check for CVA tenderness. Let me know if you have any tenderness, okay?
Nope. No.
Excellent. And now I'm just going to listen again for any adventitious sounds in your back. Just take a deep breath in and out. We're almost done. Just 2 more. One right here. Excellent. Breath sounds are equal and good bilaterally with no adventitious breath sounds heard. Okay, Miss Morgan, what we're going to do now is we're going to check your abdomen. Can I please have you lay down on the bed?
Okay.
That would just be most comfortable. Perfect. Okay, do you mind if I lift your shirt up?
No, that's fine.
Perfect. Thank you very much. The first thing you do for an abdominal exam is inspect. I don't see any sign of colon sign, no bruising, no redness, no irritation. Have you had any problems?
Mm-mm.
Excellent. And what was your last bowel movement?
This morning.
And your last menstrual period?
I was like 2 days ago.
Perfect. Okay, so what I'm going to do now is I'm going to listen. I'm going to listen for both bowel sounds, and I'm going to listen for bruits, and I'm going to do her aortic, her renal, her iliac, and her femoral. Excellent. So now what I want to do is, I know you've already told me that you're ticklish,
Mm-hmm.
so I will try not, if you need to laugh during the exam, that is okay. You can
Okay.
take a break. and
Yeah.
relax. Okay, so what I'm going to do is I'm just going to do some light touching, just, I don't know, feel for any masses, and let me know if you have any pain as well, okay?
Okay.
Excellent. You're doing good? How are you doing? You're doing
It's
good?
okay. Mm-hmm.
Excellent. Okay, so now I'm going to palpate for your aorta, okay?
Okay.
Excellent, you're doing good. I'll give you a second. Okay, so now I'm just going to palpate to see about your liver, okay?
Okay.
On your ribs, down there. Can I take a deep breath? Perfect. And since we're already on her liver, we're just going to do McBurney's, okay? So
Okay.
what this is actually filling to see if you have any kind of a gallbladder irritation, okay?
Okay.
Take a deep breath in. Copy it. I know. Take a deep breath in. Copy. And do you have any pain?
No, it was fine.
Excellent. Okay, now I'm just going to feel for your kidneys. Doing well. Doing well. Just this side. Just pulling. Oh,
Mhm.
excellent. It's really good. Okay, Miss Morgan, I can now cover you up.
Okay.
Since we're already doing this, we're going to continue. So we're going to check your appendix. Have you ever had a history of appendicitis or any appendix
No.
problems? Okay. So what I'm going to do is I'm going to have you dip your leg. And so this first one is I'm going to push your foot out a little bit. And let me know if you have any pain. This is an obturator sign, okay?
Okay.
Just immediately. Any pain right there?
Mm-mm.
Excellent. And now we're going to do the psoas sign. So can you hold that up yourself? I'm going to push up and against. Does that have any pain right there?
Mm-mm.
Excellent. You do not have any problems with your appendix at this point, which is great. And again, since we're already doing this and you're already laying down, we are going to focus on your knee. Have you ever had any problems with your knee?
Mm-mm.
Okay, so we're going to test your medial and your lateral meniscus. There are 3 tests for this. The first one is McMurray's test. So what I'm going to do is I'm going to hold this and I'm going to rotate that. Do you have any pain?
Mm-mm.
Excellent. And now valgus and valgus. This. Any pain right there?
Mm-mm.
The other side as well? Any pain?
No.
No? Excellent. Let me put that down. And so we're going to do a thing called a Romberg's test, since now that we're already here. Oh, no, actually we're going to do a positive draw test. We're just going to have the knee right here.
Mhm.
What I'm going to do is I'm going to pull against. You can just be flat. Let me know if you have any pain. This will test your ACL.
Mm-mm.
And we'll do backwards, PCL.
Nope.
Perfect. Now you can relax right there. We're going to do a little bit of neuro since you're already on the bed. We're going to do a thing called heel to shin. I'm going to ask you to put your hip to your heel, and then I'm going to have you go down. I'm going to have you rotate feet. So I'll do this one and continue to rotate them until I say stop. This test is your coordination. Excellent. You can stop there. And now I'm just going to go a little bit out of order. We're going to check your rotator cuff muscle since you're lying in bed, and this is the way you're going to do it. Perfect. Just going to have you do this. And let me know if you have any problem. This is called the apprehension test. Any apprehension?
Mm-mm.
Excellent. Okay, Maureen. Okay, so now you can actually stand up. You can get up. If you have any dizzy or any problems right now.
No, I'm okay.
Excellent. I'm going to stand up. Okay, so we're gonna do some neuro now.
Mhm.
I'm gonna head on to the neuro, and then I'm gonna call this one the trio for cops. So I don't know, hopefully you're not familiar with these. The first one is the wrong work side. So I'm gonna just hold this in case you do fall. Close your eyes
Mhm.
and just stand still. Perfect. She's not really shaking. She has great balance. You can open your eyes right now. The next we're gonna do is we're gonna take your finger to your nose, just like this, like you would do, and rotate. Perfect. Since we're already doing the triad, I'm calling it, you can put that down. I'm going to have you go heel, toe, so walk in a straight line, heel, toe. Excellent. You can turn back and walk normally for me now, please.
Okay.
Now you're going to turn back and you're going to walk just on your heels. This is all testing for coordination and any kind of neural problem. And now you're going to walk on your toes to me. Perfect. We're going to do one more. We're going to have you take your foot and you're going to put it up right here. And now you're going to just bend down. And yes, perfect. And now can I have you do it on the other leg as well? Mm-hmm. And bend down. Excellent. And you can sit down right now. And to complete a little bit of that, we're going to have you do rapid movements. So I'm going to have you do this. Excellent. Good job. Okay. So next I'm going to do is I'm just going to test your reflexes. Okay. So for the purposes of this video, I'm only going to test the reflexes on one side of her body and not both of them. Okay. I'm going to do brachioradialis right there. Just relax. Excellent. And do your biceps. Excellent. Now I'm going to have you relax right there. And do triceps. Excellent. Okay, you can relax. And since we're doing this, we're just going to do a vibration. We're just going to do vibrate up to your great toe. And then we're going to do your radial. Just let me know if you can feel that.
Mhm.
Can you do that one too? Can you feel that?
Yeah.
What about your great toes?
Yeah.
And right there.
Mhm.
Excellent. Okay, let's continue on with the reflexes. You do have hands on, so it might be a little bit more difficult.
Okay.
We are going to do the patellar reflexes. Just relax, ready? Very good. Excellent. We're going to do your Achilles reflex. Excellent. And now we are going to do Babinski, which you really shouldn't have one. Excellent. Good job. You can put your foot down right there. Okay. So that was the neurological exam. We're going to continue with the musculoskeletal exam. We do have some more. So first we are going to do the Apley test. Do you have any shoulder pain or any problems?
Mm-mm.
Can I have you take your, and now go back and touch your back. Excellent. Again, it would be bilateral, but for now we're just going to do one. And now we're going to do, I'm just going to test your shoulders. Can I have you shrug them up? And now against me. Shrug them. Excellent. Now go. And you have you move your elbows. Excellent. And now can I have you push against my arms? And now push up against my arms. Perfect. And now we're going to have you move your wrist. Excellent. And now again, can I have you push up and down? Can I have you move your fingers? Excellent. And can I have you grip my fingers really tight? Excellent. Good job. And now we're going to do a thing called trash can test. Can I have you put your hand with your thumbs like this and push against it? Any problem?
Mm-mm.
Now we're going to have you do the arm drop test. Just take this arm and can I have you put it at a 90-degree angle and just leave it there? Excellent. You have no problems with that. Okay, so again, we're going to continue movement. Can I have you come stand up right here? So what I'm going to do is I'm going to have you turn around. I'm just going to check your spine. Can I have you bend over for me, please? Again, testing spine. Excellent. Perfect. Good joint. Can I have you stand up? Can I have you lean back towards me? Excellent. And then side to side. Perfect. Great. Can I have you sit right back down for me, please? Okay, so now we're going to continue on with the exam. So can I have you push against out? Push against me. Excellent. Can I have you move your ankles? And move your toes? Push out. And now push in. And then again, push down. And push up. Excellent. Do you have any other problems or questions you'd like to address before we end this?
No, I don't think so.
Excellent. Oh, actually we still have a little bit more. Forgot about this. Part of the neuro exam. This is going to be sharp and dull, okay?
Okay.
So I'm going to have you close your eyes. Let me just put this. This is going to be dull.
Mm-hmm.
And that's going to be sharp.
Okay.
Okay? So let me know what you feel.
Dull. Sharp. Dull. Dull. Sharp. Sharp.
Excellent. You can open your eyes. And there we go. And this concludes the video. Hope you enjoy it.